Another suspect in cops' killing turned himself over to police. Another suspect in the killing of 2 policemen has handed over himself to the authorities. The accused 20-year-old Junior Brown from Seaward Drive, Kingston 11, surrendered himself at the Duane Park police station around 6 p.m. on Friday. Brown was accompanied to the station by his sister and a pastor, the police noted. He was the second suspect to turn himself in after Macaros Monroe from Ricketts Crescent in Kingston 13 was taken to the Hunts Bay police station earlier on Friday. The men are held in connection with the killing of Constable Jeremy Garden, assigned to Seatock, and Constable Charles Stewart from the St. Catherine North Division, who were shot dead during an altercation with several men shortly after 8 p.m. last Thursday. Reports indicated that the cops were engaged in a conversation with the men about the parking of stolen motor vehicles in front of their business place when an altercation ensued. During the altercation, the police said one of the men pulled a firearm and fired several shots at the both policemen, hitting them in their upper bodies. The suspects then fled the area on foot. Residents assisted the injured cops to the Kingston Public Hospital, where they died while undergoing treatment. JDF Coast Guard recovers body of suspected drowning victim. The Jamaica Defense Force is reporting that its Coast Guard has recovered the body of a man who was suspected of drowning at the Step River in St. James on Sunday, November 16. It is reported that the man was attempting to cross the river when he was swept away by the currents. The JDF was asked to assist with the search and rescue efforts. A dive team from the 2nd District JDF Coast Guard was deployed to the location, where an underwater search was conducted and the body recovered. The body was handed over to the police, who are investigating the matter. The JDF Coast Guard extended condolences to the family and friends of the deceased and reminded the public to exercise caution around rivers that are spaced, especially during periods of heavy rainfall. 60 to 70% of primary health facilities in parishes hit by Hurricane Melissa return to normal operations. 60 to 70% of primary health care facilities in parishes severely impacted by Hurricane Melissa have returned to normal operations. There are about 99 of these facilities in Trelawney, St. James, Hanover, Westmoreland, and St. Elizabeth. The nation's Chief Medical Officer, CMO, Dr. Jacqueline Bisosa McKenzie, gave the update during a virtual meeting as she encouraged persons to seek early treatment for infections as well as food and waterborne diseases. These illnesses are expected to rise following the hurricane. She said other primary care facilities have been prioritizing immunization and maternal services. 20% of health facilities are down. In the meantime, the CMO noted that efforts continue with the help of local and international partners to get hospitals in those parishes returned to full resumption.
Persons must seek care, but they must understand that there are some challenging situations. And to alleviate this problem, we have been working very hard. The primary healthcare team has been out, and the primary healthcare team have been able to get back up to routine services. We have 99 health centers in those 5 parishes. And the primary healthcare team, along with local and overseas support, have been able to get back up 60 to 70% of these facilities to normal services, meaning that if any day that you would normally have clinic, you can still go to that facility to see the doctor or to access your immunization or your antenatal care. Another 10 to 20% of those health centers have had partial services up. And that means that they are prioritizing the immunization services and the maternal care services. So where it is that the health centers may not have the clinics on the regular day, the community health aides have been out. They have been sensitizing persons to where it is, when it is they need to go to the health centers. So we're asking you to try to keep your appointments. 20% of our facilities in that area are down, and you will see the community health aides on the ground. They have been redirecting persons to where it is that they are to go for service, and the teams have been out doing mobile outreaches to try to reach persons. So Falmouth Hospital, the Accident and Emergency Department is down, but they are receiving patients, and there was damage not just to the A&E but also to the wards and to the other facilities that support the hospital. And so a field hospital has been erected, and so therefore persons who would normally come to the hospital or who have problems should still come to the hospital to seek care, and we have the use of the field hospital as well. At Cornwall Regional Hospital, bed capacity has been severely affected. It means that persons that are coming to the accident and emergency department are going to face a crowded emergency department, very challenging situation that is there. So there may be some delay. We ask for your patience, but the emergency department is still open and receiving patients. Noel Holmes Hospital has also been severely affected, but they have the benefit also of a foreign team as well as the local team that are there. And a field hospital is to be set up there so that they will be able to receive patients, and they do continue their services on a daily basis. The Savlamar Hospital, the accident and emergency department as well, is crowded. A lot of persons are there. Some of their ward space have been compromised, and therefore the ability to move the patients from the emergency department to the wards have been affected. They do continue service, and they have been supported by quite a bit of local teams that have gone in to help them, and they are going to also be setting up a field hospital so that persons can come in to be seen. The Black River Hospital, most services are down at the hospital. The accident and emergency department, though, is up, and it, along with the field hospital that has been placed in Black River at Black River High School, very close to the hospital, are open to receive patients.
Health and Wellness Minister working with stakeholders to help remove and bury dead animals. The Health and Wellness Minister is working with public health inspectors and members of the Agriculture Ministry's Veterinary Service Division to help remove and bury animal carcasses. There's an increase in dead animals, especially in western Jamaica, following the passage of Hurricane Melissa on October 28. Health and Wellness Minister Dr. Christopher Tufton said the presence of these carcasses can lead to foul odors, water contamination, and disease. In the meantime, Dr. Tufton stressed that disposal is a shared responsibility.
In the aftermath of the hurricane, the safe disposal of dead animals and spoiled food of animal origin becomes an urgent public health priority. Dead livestock, contaminated meat, fish, eggs, and dairy products can quickly lead to disease, foul odors, pests, and contamination of water sources if not properly managed. As such, the ministry is working through the Veterinary Public Health Unit. That's a collaboration with the Ministry of Agriculture, and alongside public health inspectors and our local authorities to follow strict national and international standards to remove, bury, or otherwise safely destroy animal carcasses and related waste. These actions protect communities, safeguard the environment, and ensure that response teams operate safely and efficiently. Again, a natural occurrence with flooding normally comes, and no electricity, comes animal carcasses that would perish because of the flooding, and of course those that can't be stored because of the lack of refrigeration. Farmers, local authorities, and residents who are encouraged to report animal deaths and avoid interfering with disposal sites. Burial is also the preferred method undertaken on high ground and away from water sources, while burning or incineration is used only when necessary. So this is very important. Throughout this process, workers must use protective equipment, disinfectant tools, practice good hygiene, and ensure vaccinations are up to date. And all activities should, where possible, be carefully documented, monitored, and followed up to prevent pest, odor, or contamination. And I say, you're taking things down to your friends, those who are listening who are not affected. Carry some disinfectant, water boots, gloves, the things that can help, the shovel, the pickaxe. Those are now very, very important as part of the cleanup. Not just food, but the other stuff. At the same time, communities are reminded never to use or sell meat from dead or deceased animals, and are encouraged to report carcasses through official hotlines. These guidelines are continuously reviewed and strengthened so that even in the most challenging post-disaster conditions, public health and environmental safety remain fully protected.
St. Elizabeth man killed in hit and run. The police in St. Elizabeth are searching for the driver of a vehicle which failed to stop after hitting and killing a 26-year-old man on Saturday. The deceased has been identified as Jarrett Hansen, unemployed of Junction St. Elizabeth. Reports are that about 5:35 a.m., Hansen's body was seen on the roadway in Southfield. The police were informed, and when they arrived, they observed that the body had wounds all over. The body was removed for a post-mortem examination. The Junction Traffic Department is conducting a probe of the matter. To subscribe, like, share, and click the notification bell for daily updates.